So we can start with colorectal cancer, where I think the most important thing is to not ignore blood and stool. I think in if I talk to a lot of my patients, I think a lot of them, when they come to us, after the entire diagnosis has been made, and you ask them, since when have you been having these symptoms? It's usually 6 months. 6 months is a long time to be tolerating or putting up with passing blood and stool. And then you realize that it's just 15-20 days back, when it really got out of hand, that they actually went and got tested and got investigated. Because everyone thinks that blood and stool is just piles or one of those perianal conditions. And people don't really think that this could be something more sinister. And I think that's important. That awareness is very important. So I think if there's one message that needs to go across, is not to ignore a symptom that is persistent. Any alteration in bowel habits, which is chronic. I mean, I can understand that, occasionally people get constipated or have loosies, but if it's a chronic thing, where it just keeps happening over a couple of months and it's not getting better, or if one is passing blood and stool, that's not normal, and they need to go to a doctor and get checked, and that's important. And even if somebody is young, it can still be, it could very much still be a cancer. So I think that's important, because usually people think that, I'm young, I'm just 30 years old, why would I?
Yeah.
So, it wouldn't even cross their mind. But unfortunately, I'm seeing 1 in 4 of my patients are young. So I think that's very important for people to be aware of, because these are all completely treatable conditions if you pick them up early.